Hey everyone, welcome back to the channel. Before we dive into today's critical update, I need you to understand something. What I'm about to share with you isn't just another news story. This is happening right now as we speak, and it affects all of us in ways you might not realize. If this video provides value to you, please consider supporting the channel through Super Thanks, Super Chat during our live streams, or by becoming a member. Your support helps us bring you timely, well-researched content like this. Now, let's get into it. Just hours ago, Ethiopia's health minister, Deba, confirmed something that has sent shockwaves through the global health community. 3 people have died from the Marburg virus in the country's southern region. But here's what makes this even more concerning. This is Ethiopia's first ever Marburg outbreak. Let me break down exactly what's happening on the ground. The outbreak was detected in the W.H.O region, specifically in Jinka town, which sits right near the border with South Sudan. Health officials tested 17 individuals after receiving alerts about a mysterious hemorrhagic illness, and 9 cases have been confirmed positive for Marburg virus. But it gets more serious. While 3 deaths have been laboratory confirmed as Marburg, another 3 deaths are still under investigation, showing similar symptoms. That's potentially 6 lives lost already. Now, I know what you're thinking. What exactly is Marburg virus? And that's a question we need to answer, because understanding this threat is the first step to protecting ourselves and our communities. Marburg virus is part of the same family as Ebola. Think of it as Ebola's equally dangerous cousin. It's what doctors call a viral hemorrhagic fever, which means it attacks your blood vessels and organs, causing severe bleeding both internally and externally. Here's what makes Marburg absolutely terrifying. It kills roughly 50% of the people it infects on average. But in some outbreaks, that death rate has climbed as high as 88%. Let that sink in for a moment. Unlike Ebola, there is currently no approved vaccine for Marburg. The symptoms start suddenly. Imagine the worst flu you've ever had, multiplied by 10. We're talking severe fever, intense headaches that feel like your skull is splitting, extreme muscle pain. Then, around 5 to 7 days in, things get worse. Violent vomiting, severe diarrhea, and then the hemorrhaging begins, bleeding from the nose, gums, and internally. The virus spreads through direct contact with bodily fluids of infected people or animals, particularly fruit bats, which are the natural hosts. You can also get it from contaminated materials like clothing or bedding. But here's where we see humanity at its best. The response. Ethiopia isn't taking this lightly. The government has isolated 129 people who came into contact with confirmed patients. That's contact tracing at a massive scale. They've activated emergency response centers, deployed rapid response teams to affected areas, and here's something crucial. Ethiopia established its own laboratory testing capacity for Marburg. They can now run diagnostics independently without waiting for external labs. That's huge for quick response. International support is flooding in. Teams from the World Health Organization and the Africa CDC have arrived on the ground. The Ethiopian Ministry of Health has launched public awareness campaigns in Amharic, distributing infographics about symptoms and prevention, and they've set up a hotline for reporting suspected cases. But there's a regional dimension we can't ignore. South Sudan, just across the border, has issued urgent health advisories. And this is critical because South Sudan healthcare infrastructure is fragile. If Marburg crosses that border, we could be looking at a much larger crisis. This outbreak is part of a disturbing pattern. Tanzania just dealt with a Marburg outbreak earlier this year that killed 10 people. Rwanda ended its first Marburg outbreak last December with 15 deaths, though they did test an experimental vaccine during their response. Now, you might be watching this from anywhere in the world asking, should I be worried? Let me give you the honest answer. If you're not traveling to East Africa, your immediate risk is extremely low. Marburg doesn't spread through the air like COVID-19. It requires direct contact with infected bodily fluids. However, in our interconnected world, we need to stay informed. Here's what you should know for prevention. Avoid contact with blood and bodily fluids of anyone who is sick. If you're in affected regions, avoid caves or mines where fruit bats live. Healthcare workers need strict infection control. Gloves, gowns, masks, the full protective equipment. Anyone who's recovered should avoid sexual contact for at least 7 weeks, as the virus can persist in semen. The WHO emphasizes that healthcare workers are especially vulnerable when infection control isn't strictly practiced. We saw this with Ebola, and the same applies here. For travelers, check CDC and WHO advisories before visiting East Africa. If you've been in affected areas and develop fever, severe headache, or any bleeding symptoms within 21 days, seek immediate medical attention and inform your doctor about your travel history. Here's what we need to talk about, the bigger picture that nobody wants to address. Why are we seeing more of these outbreaks? Climate change is pushing animals, including fruit bats, into new territories. Deforestation is destroying natural habitats, bringing humans into closer contact with wildlife. Urbanization in Africa is accelerating, creating new interfaces between animal reservoirs and human populations. This isn't just about one outbreak in Ethiopia. This is about our changing planet and how that's changing disease patterns. Scientists have been warning about this for years. As we disrupt ecosystems, we're going to encounter more zoonotic diseases, diseases that jump from animals to humans. The silver lining? We're also getting better at responding. Ethiopia's rapid detection and transparent reporting is exactly what we need. Compare this to early COVID responses. This is how you do outbreak management right. Quick identification, immediate isolation, transparent communication. But we need sustained investment in public health infrastructure, especially in developing nations. We need research into vaccines and treatments, and we need to address the root causes, our relationship with the environment. All right, everyone, that's the complete breakdown of what's happening in Ethiopia right now. I want you to walk away from this video informed, not scared. Knowledge is power, and staying informed helps us make better decisions. If you found this deep dive valuable, here's how you can support what we do. Hit that super thanks button below. It directly funds the research and production of videos like this. During our live streams, your super chats help us continue these important conversations in real time. And if you want exclusive behind-the-scenes content and early access to videos, consider becoming a channel member by clicking that join button. Don't forget to subscribe and hit that notification bell because this situation is developing and I'll be bringing you updates as they come in. Drop a comment below. Are you concerned about these emerging outbreaks? What questions do you have? Share this video with someone who needs to see it. Information saves lives. Stay safe out there, stay informed, and I'll see you in the next one.